At 23 years old, she had a bright future ahead of her.
She was just so dedicated to the work here, just a real champion.
Sophia was a rising star at work, and she passionately cared for others.
Beautiful smile, highly intelligent, beyond her years.
The Nanaimo woman worked at a homeless shelter and graduated from a mental health program at Vancouver Island University.
The guests at the shelter liked her and respected her. She was compassionate and caring.
Sophia advocated for strangers, but when she needed help, her mother says the healthcare system failed her.
If Sophia had had a family doctor, she probably would still be here today. Somebody who really knew her and would follow her care.
Her mother asked that their last name not be used and not to appear on camera. Last summer, she fell ill and took a medical leave from the shelter, but without a family doctor, she struggled to get care.
She started getting sick and just trying to get see a family doctor to find out what was going on.
At 6 a.m, she'd walk to the nearest clinic to try and see a doctor.
People would come out and they would say, we're at capacity or we don't have enough staff today.
Finally, she was able to see a doctor, but her mother claims she was misdiagnosed.
She was adamant it was not an eating disorder. And we told them that when I took her to the doctors, the ER, the first time in October. I wish that I had pushed the professionals further and harder.
Her mother took her to the hospital in Nanaimo, where she was misdiagnosed again. A month later, she went back to the hospital, learning through a blood test that she had an immunodeficiency and an infection, likely from the shelter she worked at.
Because it took so long to diagnose that infection, she ended up with sepsis. It just got to a point where her poor little body couldn't take it anymore and it couldn't fight.
Days later, she died at a Vancouver hospital.
I just don't want my daughter's death to be swept under the carpet. I think that changes need to happen, and the only way to do that is to tell Sophia's story.
Island Health is reviewing Sophia's care journey and has connected with her family. A spokesperson says this is a tragic loss of a young person who, by all accounts, was dedicated to helping those in their community.
Her death was so unnecessary. It was so preventable.
The Ministry of Health did not respond to Glacier Media's request for comment. Island Health did confirm Sophia had multiple patient visits.
I feel sorry for that community who fight every day for the less unfortunate in our society. And they lost an advocate because she would have done big things.
Alana Kelly, Glacier Media, Vancouver.